Hi, everyone. Thanks so much for joining us. My name is Nico Murillo, for those who don't know me, and I'm the chair of Texans for Safe Access. And I'm so excited to have Dr. Darina Douchi join us today to talk about this important conversation about PTSD. So I want to read Dr. Darina's bio before we bring her on. Dr. Darina Douchi is a cannabinoligist clinical pharmacist with 17 years of wide varieties of expertise in the field of pharmacy. She is also a retired major from the U.S. Army with nearly 9 years of service. She is a wealth of knowledge in the field of clinical pharmacy, pain, and psychiatric medicine, focusing on the Army Warrior Transition Unit soldiers. During her service, she endured a major back injury that manifested into chronic pain, migraines, and a lieu of ailments related to her back injury, like depression, insomnia, and anxiety. Knowing how quickly she could become dependent on opioids given her chronic conditions and the combination of medications she was on, she refused the standard opioids as treatment and became interested in the medical benefits of cannabis. Since retirement from the U.S. Army in 2017, Darina has devoted her time and effort to educate and enlighten the medical community with the vast benefits of cannabis and to change the stigma associated with the plant. During her spare time, she enjoys gardening, cooking, and spending time with family and friends in her home in San Antonio. So I'm going to go ahead and bring on Dr. Darina now. Hello, Dr. Darina. Thank you so much for joining us.
Hello.
So I'm going to get right to it. I have some questions for you about PTSD, and you're the perfect person to ask because you are a veteran and you know a lot about this stuff. So, can you tell us what is PTSD?
Unfortunately, it's a very common psychiatric disorder that results from traumatic events, and it manifests through hyperarousal, anxiety, depression symptoms, and sleep disorders. It is more common than we think. According to the National Center for PTSD, they estimate that there's 10% of the U.S. population actually has PTSD, and that's about 7 to 8 people. So 7 to 8 people per 100 actually have PTSD, and that's adults ranging from ages 18 to 65. So they're not even considering the children, which also do have PTSD that manifests differently. Now, when we look at the veterans community, that number actually doubles. It's actually 20% of the veterans post-deployment have PTSD. So you also have to remember there are also veterans that are not deployed that also develop PTSD. PTSD is not just related to deployment, but we see it higher in deployment situations. And it manifests through different ways. Some of the things that we notice is that patients have a lot of anxiety and they can't sleep and they can't cope. They become isolated, irritable, which affect their jobs and their marriage situation and their lifestyle in general.
Yeah, that's real unfortunate. And so, what are the current treatments for the VA for veterans with PTSD? Are there any?
There are, it starts with psychotherapy and medications. There are different class of medications that they tend to use and rely on, like antidepressants, which helps control the PTSD symptoms as far as sadness, worrying, anger, feeling that numbness inside. Other medications also that treats PTSD for like sleep and nightmares are being utilized. Some of those are like SSRIs, like your typical Zoloft, Prozacs are very common. And of course, whenever you start putting patients on those medications, they tend to have other side effects that things like sexual dysfunctions. Now you have to give them medications for that. And then you have, it causes problems with sleep, and then you have to treat the sleep problem. So with PTSD patients, we end up seeing a cocktail of treatments. And that's what makes it a very difficult group of patients to treat, because it's challenging because of what do you put them on? And then now they develop a new side effects or new symptoms related to some other issues.
Okay. And so everyone's talking about cannabis for PTSD. Do the veterans support the use of cannabis for PTSD?
So veterans, yes. VA, it's a 50-50. We'll talk about the VA here in a second. But veterans have actually been, so far, are the one group in the society in the U.S. that actually is driving this mission and wanting to legalize it. A group by, there's an Iraqi and Afghani Veterans of America. It's called AAVA. They represent about 400,000 veterans. They did a study a survey to see, do veterans want this? And it showed that 83% of the veterans actually are interested in having cannabis as a medical option available for them. So we know they're supported, and we have a lot of advocacy groups out there that are driving this force, and we support them as well.
Perfect. Yeah, that's a high percentage. That's great. That's great to know. But is medical cannabis legal right now?
So it's not legal in every state. So we have to distinguish when we talk about cannabis. Cannabis is a general term. It's a big term. We have what's called the hemp. The U.S. Department, USDA, legalized hemp, and hemp plant is the one that contains less than 3.3% of THC. THC is the psychoactive ingredient. Excuse me. The other cannabis plant is the marijuana, which a lot of people know, and that's the one that has more than 0.3% of cannabis, of THC in it. Now, based on states, all states have hemp available and legal. The medical marijuana we refer to is only available right now in 33 states. So depending on what you're trying. So when we say cannabis, that's a broad term, and we'll distinguish which one is which as we talk.
And Dr. Darina, do you believe that cannabis helps with PTSD?
So it's not a personal opinion. I go by studies. There is a correlation between what's called the endocannabinoid system, and we've talked about the endocannabinoid system. We have several episodes on that. And also the PTSD. So there's your own body actually has a system called the endocannabinoid system. It's a natural part of your body. It's a crucial system, and it's what we call a biological cell signaling system. And the reason we call it that way is because it contains receptors, cell signaling, ion channels, neurotransmitters, and if those, your own body actually produces a cannabis-like chemicals that we call endocannabinoids, and those are referred to the chemicals that are produced within your body. So endo is within, cannabinoid or cannabinoids are cannabis-like products, so endocannabinoids. And the two popular ones that we hear a lot about, one is called 2-AG and one is called AEA or anandamide. So if in case sometimes the vowels just get it in the way, they play a really important part in the way your body performs its function and how they communicate with other systems in your body. And the endocannabinoid system consists of a lot of receptors. So those endocannabinoids I mentioned earlier, they send signals and they talk to the receptors in your body. So the two common receptors are CB1 and CB2. CB1 is found abundantly in your CNS, in your brain, your spinal cord. And the CB2 is available throughout your body, but it is also available in your brain. So they do work together. So depending on which chemical you're taking in the cannabis plant and different concentration, you're going to see a different response. Now, what we have actually, what they have looked at is that communication between the endocannabinoids, the deficiency in those anandamide, and how in PTSD patients. So we know that CBD, which is one of the chemicals available in the hemp plant or the cannabis plant, with the THC, they're actually capable of helping treat patients suffer from PTSD by improving that connection or that messaging signaling process between the receptors and the rest of your body. I do want to mention something. There is a phenomenon or a theory that Dr. Russo, he's somebody I really respect because he's studying this theory, and he supports that there is a clinical endocannabinoid deficiency in our bodies, meaning you have the system, but it's under functioning. And because it's under functioning, that results in certain medical disorders being resistant to treatment. And when we've given them cannabis, either form, whether it's marijuana or hemp, it actually boosted that deficiency and it improved patients' outcomes. Now, one study that was interesting that they looked at when the World Trade Center was attacked. There was a study in 2013, and I have the name, it was done by Matthew Hill and his associate, his research group. They looked at the reduction in circulating endocannabinoid levels in individuals with PTSD following exposure to the World Trade Center attack. They actually wanted to see they knew that the endocannabinoid system signaling has been identified as a modulator of adaptation to stress, and it is integral to basal and stress-induced glucocorticoid regulation. So we know that it's responsible for your stress hormones level and how they circulate and communicate with your body. So they've identified that in many other studies before that. They also later on, they wanted to look, well, what's the interaction between really this endocannabinoid and your glucocorticoids, those stress-related hormones. And they wanted to show, because that's been shown to be necessary in that regulation of your emotional memory, which suggests that the endocannabinoid function may actually relate to the development of PTSD. So they took actually the plasma levels from 46 individuals that had been identified with PTSD post that exposure, post the 9/11 exposure. And they found that these individuals actually had a lower 2-AG. 2-AG is the endocannabinoid that your body naturally produces, and it's the one that's essential in regulating your stress responses. And also they also noticed that the AEA was also lower in those patients, and that anandamide is actually responsible. We call it the bliss hormone. It's the one responsible for euphoric effect. So after they conducted it, they realized that, those patients actually did have a lower endocannabinoid level, which actually correlated to why they had PTSD compared to patients that didn't have PTSD and they did have, but their levels were normal. And we also do speak a lot to the veterans in the community and veterans that have had PTSD and have gone through the conventional VA standard treatments for PTSD and failed after numerous medications and cycles of therapies. They ended up using cannabis and they have been relieved from taking medications, and they've been coping with life, and their marriage has been fixed, and they just feel great overall.
That's great. And so what currently is the VA's stance on cannabis and the FDA, or do they share the same stance?
Not really. They still consider cannabis, marijuana, as a class 1 controlled substance. So they put it in the same classification as heroin, which makes it illegal for everybody to get, even though on state levels, so you've got the federal versus state level. On the federal level, it's still looked at as an illegal class 1. You can't have it, you can't travel with it, you can't ship it. But on state by state level, some of them are legalizing it. The FDA does not believe that, because we don't know how it works. That's what they claim. They don't know how it works. They don't believe it works. The VA is the same situation. They have done some studies and they're questioning, it's a 50-50. They're not very sure. Now, what the FDA usually and the VA rely on is what's called evidence-based medicine, which seeks reliable answers that can help you find treatments. And usually they do that through clinical studies. After they do clinical studies, they come up with their decisions. But there's also another thing called real-world evidence. Real-world evidence in medicine means the evidence obtained from real-world data, from actual observational trials or studies. In these situations, as veterans who have been using cannabis and we have been relieved and feel relieved on cannabis, we are considered real world evidence. So this is where the argument is, and how a lot of us veterans are pursuing to legalize it, is because we have conducted our own real world evidence really to support the claim.
Yes, absolutely. So, is there anyone looking to change the law for veterans?
There are actually several bills in place that have been proposed to the Senate, trying to change some of them. It's called the Veterans Equal Access Act, would allow the VA health providers to recommend medical marijuana to their veterans patients. There's also the VA Medicinal Cannabis Research Act, which direct the VA to conduct a large-scale clinical trials on the effect of cannabis for PTSD. There's also the VA Medicinal Cannabis Research Act of 2018, which would support scientific and medical research into medicinal cannabis for veterans with PTSD, TBI, chronic pain, and other illnesses. There's also the Veterans Medical Marijuana Safe Harbor Act, would enable the VA physicians to issue medical cannabis recommendations to their patients, because right now they're not allowed to do that, even if they believe in it.
Okay. Yeah, so quite a bit to look into. So, if I'm a veteran, can I use cannabis, and would it affect my VA benefits?
So here's the thing. The VA has actually guidance, and I'm going to send you the link, Nico, to put on at the bottom of our link, because I think veterans do need to understand that. So right now it's legal in 33 states, and the VA is realizing that almost everybody is taking it. So they've decided that if you are taken, or if you test positive for cannabis or THC, they will not deny your VA benefits because of marijuana use. So it's really important that you understand that your VA benefit will not be affected. Now, the VA is encouraging the patients to discuss their marijuana use with the VA provider. And this is really important because, one, you want to create that trust relationship with your provider. Two, they need to know so they can conduct proper drug-drug interactions, and that way they know to even direct you to somebody in their own treatment group that can help, because not every clinician out there knows about how to deal, or full understanding of cannabis, but I'm sure they probably have one or two on their teams, so they'll at least assign you to that individual that can support you. Also, the VA healthcare providers, they can take that information from you, they'll put it in your record, but they can't recommend that for you. They can't tell you to go use medical marijuana. And there's a list. I will actually give you that link, and then the veterans, I encourage all the veterans to look at it and just stay informed, just for their own rights.
Perfect. Thank you for that, Dr. Darina. Well, that's all the questions I have for you. Is there anything else you would like to add before we sign off?
Yes, I do actually. So we as veterans, we are actually a very strong group. We're very educated, and we're well respected in the industry and in America. I will ask of all my brothers and sisters to actually pursue the knowledge and information and learn, teach yourself, reach out to different advocacy group in your community. There are plenty of us. Different advocacy groups support different missions. So know who shares your opinion. Reach out to us or to other individuals, learn from us, and we're here to support you, because the more of us that use it and support it, and you voice your opinion and you do discuss it with your providers and you have it written in your records, the VA, I'm sure, is compiling that information to conduct their own internal study, and eventually they might legalize it as we speak out about it.
Yes. Well, thank you so much, Dr. Darina, for joining us and sharing all this knowledge about PTSD, and for all the work you do for veterans and for our chapter. So thank you
My
again.
pleasure.
All righty, y'all. So thank y'all so much for joining us, and join us next time on these exciting conversations with our board physicians, going over a lot of educational topics that we find completely interesting. So join us next time, and thank you so much.